Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. We all know the hospitals are in dire straits. The waiting lists are beyond a joke, and you're more likely to die of cancer waiting to see an oncologist than to actually see an oncologist. But if there was some way in which something like £8.5 million a year could be saved, you'd think some manager would go, that's a good idea, and do it. Well, there is a way in which about £8.5 million a year could be saved, and yet no one is actually doing it. They are wasting £45 million over the last 5 years, and for no reason whatsoever as far as I can see. It's an easily solvable problem, but one that nobody, it appears, wants to do. Let's have a look to see how money can be saved, lives can be saved, and you could employ many more doctors and nurses for net zero cost. Here goes. So, taxes. There you go. You can see the headline. Taxes for taxes. Scottish Health Boards fork out £45 million on private transport. And this is for moving people and materials around the whole country. Jackie Bailey reckons the SNP government needs to support health boards to help prevent these costly taxi journeys. Now, it's easily done. How much is a Ford Transit? Let's say 50,000. Keep the numbers easy. 50,000 for a Ford Transit. You buy 10 of them. 10 Ford Transits, £500,000. That's 100,000 a year over the same 5 years, right? You capitalise it out. That's 100,000 a year. 10 drivers. You put them all on 50,000 each. That's £500,000 a year, right? And so that's £600,000 a year over 5 years. £3 million. £3 million. It would have cost you £3 million. There's £45 million. That leaves £42 million over 5 years. Divide that into the numbers of doctors and nurses that you throw into the A&E, and your A&E shrinks to nothing. Bang. Nothing. You wouldn't have hours upon hours or days of waits. You wouldn't have people waiting 19 hours in an ambulance in a car park waiting to get in to A&E. You would literally have a walk-in sorted and gone. £42 million over the last 3 years. 5 years. It would have paid for itself, and it would be net zero cost because it's money that's already spent out. It would have cost you nothing. Why can't these managers see this? What is actually wrong with them that they think that taxes are the right way to go? It is madness. Scottish Health Boards are forking out millions of pounds in taxpayer cash every year on taxes, according to new figures. The country's regional authorities have spent £45.7 million since 2018 on private transportation. And the actual figure is likely to be higher because only 13 of the 14 boards responded to a Freedom of Information request. So let's add another 8% onto that. You're talking nearly getting on 50. It's £50 million. Getting on for that way. And that is taxi costs for patients are not included. NHS Lothian had the biggest tab, having forked out almost £9 million. So you've got to add your taxi fares onto the patients to get them home. I mean, seriously? Buy a few minibuses, hire a few drivers. Have a hospital minibus service at a 20th of the cost. And pump the rest of that money into healthcare, into hiring doctors and nurses, into sorting out the A&E waiting list. And once you've got the A&E waiting right the way down, you can free those doctors up to go and work in other parts of the hospital and pull in specialists and things like that. You can... It's not just me, is it? It's just sensible. Surely. Bring it in-house, sort it out at 20th of the price. Unbelievable figure. Anyway, NHS Great Glasgow and Clyde spent nearly £8 million. The figures were obtained by Scottish Labour, who called the breakdown one of the reasons for use alarming. So the NHS Glasgow and Clyde NHS Lothian have spent £3.8 million between them transporting staff. And both boards have spent about £4 million on ferrying medical equipment drugs, patients' notes, bloods and specimens, and even laundry. Laundry, for Christ's sake. Labour has called on the SNP government to support hard-pressed health boards so that unnecessary and inexpensive spend on taxis is ended. The party's health spokeswoman Jackie Bailey asked, with Scotland's NHS under severe pressure thanks to savage SNP cuts, eyebrows will be rightly raised over the amount of money being spent on taxi services. I can solve that overnight. Literally overnight. At such a low cost. It would free up millions that could be pumped into healthcare. Why are people not doing that? This is what happens when you have a health secretary who doesn't understand what he's doing, that's too busy worrying about the wanky material on his iPad to actually go, no, let's stop that. Let's change that. Let's do this instead. But he can't do it because, brain's not on the job. This is why Matheson had to go. Matheson had to go because of all the other stuff, but this alone is a reason why Matheson had to go. He so wasn't able to do the job. My God, if I walked in as health secretary tomorrow and went, bang, I've just saved £42 million a year, day one, I'd be hailed as a hero. What are you using that £42 million for? Well, I'm going to employ 4 more doctors in each of the 100 hospitals. And how are you paying for it? Well, I've got £42 million. Sounds about right. My maths is good. Seriously? 4 doctors, 100,000 a year. So that's 400,000 a year. 100 hospitals. 40 million. There you go. 4 extra doctors in each of the 100 hospitals. And how much does it cost the public purse? Nothing. It beggars belief that people aren't doing this. Anyway, while taxi journeys will be necessary in some circumstances, no. Patient safety should always be paramount, and we cannot allow the costly use of private transportation to paper over the cracks of the SNP underinvestment and mismanagement. Just get buses. Get your own minibuses. Have hospital minibuses that can go and drop people off, or if necessary, move them from one location to another location, even within the hospital sometimes, if you have large campus hospitals. Things like that. It's not hard. It's really not hard. The third biggest bill was accumulated by NHS Highland, which has spent £7.4 million between April 2018 and the start of this year. Now, I'm not surprised, Highland, because everything's a long way away from each other, aren't they? It's very few and far between, and so sometimes the journey can take some time. But again, you had a couple of minibuses, you can do it on a route and go boom, 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 jobs are good. It's cheaper by far. By a long chalk is it cheaper. Why is nobody doing this? A Scottish Government spokesman said taxi spend was a matter for individual NHS boards. He's right, it is, but it goes to show that the boards are being mismanaged. And who manages the manager? The minister. He added, we will continue to work closely with the boards to ensure the best possible, blah, 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 more of the same. It's all rubbish. Put it in. All you got now, brand new, Neil Gray, come on, do your best thing. Day one, create a new NHS hospital transport service and tell the hospitals they have to use this. And you buy the fleet and you man the fleet and the fleet's there and they get paid a salary and that's fine, but you're not having to deal with all the other stuff. Jobs are good. It's got to be cheaper. Got to be. Even just the capital outlay can be written off over 10 years. Write off the capital over 10 years. The net effect then is that the capital is free. These people, I just don't get how stupid they are. It's annoying, isn't it? It's annoying how stupid these people are. And they find themselves at these dizzying heights of being a minister of state and don't do the sort of things that normal people see are perfectly sensible. Unbelievable. Anyway, I'm going to stop there. I'll come up and we'll round off. So there you go. There was just today. It's just come up. We've been presented with this issue. We've identified what the problem is. We've analysed what the problem is. We've worked out what the costings could be. We've provided a very cost-effective solution. We've shown how easy it is to run and maintain. And we've shown that the savings themselves will not only save money for the NHS per se by not spending on taxes, but will long term make massive savings if you're putting in all those extra doctors to help clear all the waiting lists. And that itself will then ease the problems within the hospital, making the hospitals themselves even more efficient. One problem, many solutions. Life is better for everyone. Why can't they see that? That's taken seconds to work out. Literally seconds off the top of my head. It's as simple as that. Because I'm not a moron. Sorting problems is easy if you've got half a brain cell, which is more than what it's required, I think, to become a cabinet minister. Anyway, I shall stop. Thank you very much for watching. Let me know what you think in the comments on this one. But I think it's obvious, isn't it? It's an obvious solution. Anyway, till next time, stay safe, stay well, and I'll speak to you later. Bye. Taxi.